Hey everybody, Dr. Rob Silverman here. I hope you had a great weekend. Last night I was watching a little TV and I watched 60 Minutes. I think it's a great show. And in that, 60 Minutes was talking about a study being done at Mount Sinai Hospital. And in Mount Sinai Hospital, they were talking about all the symptomology of the long haulers. It was really good. Definitely, if you get some time, worth watching. So several people were texting me and said, you know, you've been exposed to a lot of people who are post-COVID. What's a long hauler? What's one of the more common things in people that have long haul, like symptomology? And try and give me something like out of the blue that'll really impress me about why you think people are long hauling that they're not looking at, especially after seeing the 60 Minutes piece. So interestingly enough, this is a compendium of a bunch of articles, but one of the biggest symptomologies of being a long hauler because of COVID-19, post-positive COVID-19, is what we call shortness of breath, or SOB, if you will. So the shortness of breath is one of the number one symptoms. There's others. There's a lot of fatigue that people talk about, but the shortness of breath is something that I wanted to anchor on today. Dr. Fauci defined the long haulers very simply as somebody that has no detectable organ damage group, post-viral syndrome, and they call it, believe it or not, myalgic encephalomyelitis. We used to call this chronic fatigue syndrome. So the number one thing that we're seeing is that shortness of breath coupled with the chronic fatigue syndrome. They used a great example of people yesterday who had ridden and rode. Some people had rode triathlons. Others had run marathons. And they're having trouble basically walking a block without being out of breath. So why do they have this shortness of breath? Well, shortness of breath, believe it or not, typically comes from a couple of different things. These particular individuals did not have any damage. Remember, no organ damage. They did not have any fibrosis to their lungs. So a good way to test somebody is the vocal cords. Look at the vocal cords. The vocal folds are not moving in sync with your breathing. The vocal cords close instead of open. So by closing instead of open, you get a shortness of breath. So you could test it to watch. There's 5 words that you could ask a patient to say, or test yourself. Look in the mirror. We see 3 green trees. So I was able to say that. I'm not out of breath. This shortness of breath, this vocal folds not moving, really come from something called vagal neuropathy. So viruses attack different organs, but they also attack nerves. The number one nerve that we're talking about in the shortness of breath is the vagus nerve. Vagus nerve, the great wanderer, that's what it actually means in Latin. That's why they say it. The reason they call it the great wanderer is very simply, it goes from the top here, from the bottom of the brainstem, medulla oblongata, down all the way through what we call the transverse colon. Attaches to the outside of the transverse colon. Has branches to specific areas like the lungs, the heart, the pancreas, the liver, the kidneys, the intestines. So it wanders all over the place. It probably would be considered, if you unraveled it, the longest nerve in the body. It's typically saved for the sciatic nerve, but in this instance, if you put it all together, it's certainly the longest cranial nerve, which is cranial nerve number 10. So one thing about the vagus nerve is it's bilateral. There's one on the left and there's one on the right. The one on the left has a main property of satiety, a feeling of fullness. The one on the right has more of a property of mood and behavior. But because this is a interesting nerve, it's a parasympathetic nerve. If it is what they call that vagal neuropathy and it's decreased, people aren't going to breathe as quick because the sympathetics are up and they're going to get that shortness of breath. So the real question is, what do you do when you get a vagal neuropathy? Well, number one, they didn't talk about that last night. Number two, here's some natural alternatives if you have a vagal neuropathy. Now, by the way, as I share these with you, please, everybody understand, this is not a very unique thing. This is common. The long haulers are really common. Many of them do have this symptom of shortness of breath. And here are some vagus nerve treatments for the vagal neuropathy. Number one, I believe in a very staunch nutritional protocol. So the approach should be real simple. We want to be much more alkaline than acid. Vagus nerve does not like acidity in any way, shape, or form. Most structures don't like acidity. So alkalinity, like a 7 or higher. Lots of good quality fruits and vegetables. Good quality foods, no processed food, and sugar is extraordinarily acidic. In addition to that, booze, alcohol is bad. So you've got to minimize all that, eat a better diet. Some of the supplements that I've used in office to help with any kind of vagus nerve issue would be omega-3 fatty acids, a good quality probiotic, L-citrulline. Now the omega-3s and the L-citrulline are very unique in that they increase what we call heart rate variability, the ability that your heart rate to vary, go up and down and up and down. The more that it varies within the beats, the heart rate variability is bigger, the healthier you are. So there's a direct correlation between increase in heart rate variability and proper vagus nerve tone. So those nutritional recommendations are as such. I would add to them the time restrictive eating. Time restrictive eating has really shown to really help the idea of stimulating the vagus nerve because you're giving your gut time to relax. You're giving it time to relax and digest the food, and you're decreasing you're increasing something called the migrating motor complex. The migrating motor complex is a peristaltic contraction in your gut from your stomach through your intestines to move the food bolus. When you eat, it slows it down. When you don't eat, like in a time-restricted eating, intermittent fasting, you move that increases vagal nerve tone. So that would be sort of the foods, the supplements, and the last thing, a lifestyle hack. The big lifestyle hack is, not going to be a surprise, sleep. Sleep, without question, lets all your body systems reset, one of which, without question, would be your vagus nerve tone. Now, just so you know, your vagus nerve is in charge of your parasympathetic nervous system. It's the captain of the ship of communication between your gut and your brain, and it's also communicating with your central nervous system. Let's talk about a modality that I would use to help with vagus nerve neuropathy. Now, neuropathy, vagus nerve, I have it right here, my handy dandy laser. Here's my Erconia laser. So the laser is what we call, this one is the EVRL. You may not be able to see it. It's called the Erconia violet red laser. I'm going to use the violet light. Everybody knows me for the vagus nerve move or the pattern vagus nerve stimulation with the laser. So essentially, I turn on the violet light, and probably everybody can see me right now. It's not showing all that well on this particular color. I take the vagus nerve, and I'm just going to use it on the right side, and I go from the medulla oblongata down through, I'm going to stand up a little bit, the transverse colon, bring it back up, and you sweep the area for 30 to 60 seconds, each side, or as we like to say, bilaterally. And I use this in my office on all my patients. Now, the Erconia violet red laser has a red and a violet component. The red component, real quickly, is great for wound healing. A lot of FDA clearances for musculoskeletal improvement. The violet light, more antimicrobial, antiviral, antibacterial. So it's a great choice to add into everybody's toolbox. So those are the three things I would do for the vagal neuropathy. So the big thing that I can tell you about COVID-19 to help decrease your incidence, decrease your viral replication, and post-COVID with these long haulers, all these are alternative therapies. Good diet, exercise, low-level laser therapy, and the such. Now, there was a study in the Annals of Internal Medicine on November 11th, 2020, and they spoke about life after COVID-19 hospitalization. Here's some of the data. Within 2 months of leaving the hospital, 7% of the patients died. More than 10% came from the ICU, and 15 ended up back in the hospital. 2 months after hospitalization, 39% of the patients went back to normal activities. 2 months, 4 to 10. So those who get this really are showing some detrimental effects and really getting back to the activities of daily living and your performance at the level you were. People are just resting. People are just hoping We've got to get a little activity in there. We've got to get that diet up there. We've got to get that laser in there. 11% of the people 2 months after hospitalization couldn't carry out basic care. 23%, again, 2 months after, had a shortness of breath climbing one flight of stairs. Now, the biggest long haulers, the demographic group that's showing the most symptoms, 20 to 40-year-olds. 1/3 had ongoing COVID symptoms. 26% were working fewer hours. That's 1 in 4. 37% had minor financial impact. So 1 in 3 had a financial impact. And I thought one of the most interesting points that the doctor made yesterday, and I've made this before, the unfortunate thing with this COVID-19 is it is putting a strain on the healthcare system. It puts an economic strain on the long haulers, so we have to help them. We've got to help treat them. Share what I'm sharing with you. Let everybody know about it because it's going to be an economic health strain for them. The study was 38 different hospitals in the state of Michigan, and it was 1,250 patients. A lot of people are talking about the loss of a sense of smell with COVID-19. It's one of the number one symptoms that they see. Well, MRI data revealed a transient edema of the olfactory clefts. So the olfactory nerve is up here, olfactory clefts. So edema, there's swelling and there's pressure in the area. 20 patients they looked at, 19 out of 20 who had COVID-19 had a complete obstruction. 1 month later, 7 of 20 had the obstruction. So you're looking at 2/3 of the people already in a month got their sense of smell back. Those control patients had no obstruction, meaning those who did not have COVID-19 had no issues. And last, let's tie up a little bit with COVID-19 and mental illness. Here's a study from The Lancet Psychiatry, November 9th, 2020. 1 in 5 COVID patients developed mental illness within 3 months of testing positive for the virus. Those with pre-existing mental conditions were 65% more likely to be diagnosed with COVID. So again, I'm not here, I'm not taking a political stand, left, right, blue, green, all this other stuff. All I wanted to say is those who get it, there are some detrimental, deleterious effects. We have to look at the symptomology and understand that it's not just a flu. Understand that it attacks organs. Understand that it's a blood vessel issue. But this virus, to segue back to where we started, also damages nerves. It is a central nervous system issue. And I, as a chiropractor, am very comfortable with central nervous system issues. I, as a functional medicine doc, functional medicine means I look at systems, not symptoms. I try and help the system to get to the root cause of the resolution of the issue. So that's why we use the term functional medicine. My approach is functional nutrition. And some of the nutrition I recommended for you was for the vagus nerve neuropathy, of course, my handy dandy laser. Laser does a great job. I'm really excited about adding all these different modalities into, I'm just checking, into my, what I like to refer to as my doctor bag armamentarium. So I can see a lot of people popped on now. I'm happy everybody's watching. If you have any questions, please feel free to ask me. I'd like to add to that, share this, please. This is valuable information. I'd love you to share it, comment. Let's get the message out. It's been my pleasure. Dr. Rob, always yours in health.